Raise your question. Okay, so if you have read and understood, considering it's surgical anatomy station, kindly please begin. Right, I'll show you. If you can tell me, what are you looking at? What is this region?
This is anatomical specimen showing the pelvic region with the iliac bones, proximal femur,
You
and
cannot
the
say
sacrum.
pelvic region because it's showing sacrum, but not exactly pelvis. Pelvis is when you're looking at something from the front, right?
Okay, ma'am.
Pelvic is when two hip bones or join in front in that shallow or deep structure that. But this is you're looking at from the back. Okay, if I ask you, looking at from the left hand side, if I ask you to recognize or identify this structure,
It
please.
is gluteus medius, ma'am.
Okay, if you can identify
Gluteus
this,
medius,
yes, if you can identify this thicker one, please.
gluteus maximus.
Okay, what is this is pointing at? This arrow is pointing, or
Ma'am,
my cursor, you can say, it's pointing at what, please?
that is coccyx, ma'am.
Okay, coccyx. How many coccyx are there?
4, ma'am.
Okay, all right. What is this?
That is ischial tuberosity.
Ischial tuberosity. What are the structures which are inserted here? Can you name few?
Quadratus femoris auxiliary from there. Semitendinosus, semimembranosus,
Okay, if you can
and
identify, thank you. This was the superficial layer, as you could say. See, and if we move to the deeper layer, can you please identify this structure?
this gluteus minimus.
Okay, can you please tell me, this is minimus, yes. If you can identify this structure over here.
It's piriformis.
All right, and this one?
That is obturator
Internus.
externus.
Internus,
Internus.
yes. If you can tell me the blood supply of origin and insertion of this muscle.
Obturator, ma'am.
Internus.
Origin is from the inner border of the. Ma'am, can
Okay,
it
we'll
come
come
to
back to that
come
later.
to your
All
question
right, can
later?
you, in this image, either on the right side or the left side, identify,
Hello?
yes, can you identify quadratus femoris?
Hello?
Can you hear me? Would you be able to identify quadratus femoris, either on the right side or the left side, please?
It's the last muscle in the bottom, ma'am, on the right side.
Okay, good. Can you tell me the origin and insertion of this muscle?
It originates on the lateral border of the ischial tuberosity and inserts to the quadrant tubercle
Tubercle. Okay, of the
on the
femur. What
femur.
is the, yes, nerve supply of this muscle?
And now to quadratus femoris.
Right. And all right. Okay. If you can tell me, if we can move on and identify, if you can identify which bone you are looking at, how the hip joint is formed.
Hip joint is formed from the femoral head, acetabulum,
Yes.
surrounded by capsule and ligaments, mainly pubofemoral, ischiofemoral, and iliofemoral ligaments.
Okay. Can you tell me, can you please tell me what is the course of the sciatic nerve?
The sciatic nerve originates from the lumbar plexus, and
Okay.
it's marked
Please
surface
tell
marked
me the
by
root value as well. Which lumbar flexure?
L4, L5, S1, S2, S3,
Okay.
and
Then,
it comes out of the pelvis through the uh, greater sciatic foramen under the piriformis muscle, and in the gluteal region it lies under the gluteus maximus posterior to the hip joint, and as it goes down it lies between long head of biceps and adductor magnus, and towards the lower third it divides into corn peroneal and tibial nerve.
all right. Okay. Can you please tell me which vessels exit from the greater sciatic foramen above the piriformis muscle?
Superior gluteal nerve and vessels.
Okay. These vessels supply which muscle?
Superior gluteal nerves and vessels supply the gluteus maximus.
Yes.
No, sorry, gluteus
Yes.
medius and minimus, and the tensor
And the
fasciae latae.
inferior supplies the gluteus maximus. You were saying opposite. Okay. Can you please tell me, you've just told me about the sciatic nerve cord. Can it be present with variation? If yes, how?
Yes, normally the common peroneal and tibial components of the sciatic nerve are in single sheath, and it comes under the piriformis. In variations, they can be separate, and the common peroneal part will either penetrate the piriformis or goes above the piriformis, while the tibial part will come under the piriformis.
If a patient happens to have weakness of gluteus medius and minimus, how would you clinically confirm that?
By checking, doing the Trendelenburg test,
Yes.
ask the patient to stand on one limb and look for any pelvic tilt.
Yes.
If the affected side superior gluteal nerve is injured, the pelvis will tilt to the or drops on the other side.
Sound side drops. Yes.
So,
The one which is not injured, that one will be dropped.
yes,
Sound side sags. Yes.
sound
Okay,
side
good.
drops.
Yes. Good. All right. Okay. Can you tell me what is iliotibial tract and where does it insert?
Iliotibial tract extends from iliac tubercle on the iliac tubercle to the lateral aspect of the femoral tibial condyle. It mainly stabilizes the hip and knee joint
Okay. Right. If you can, please look at this image and identify lesser trochanter of the femur. Which one would that be?
lesser trochanter is number 5.
Okay. What are the
Number
muscles
5.
which attach to lesser trochanter of femur?
Psoas major and iliacus.
Very good. Very good. Excellent. Good. Thank you. Thanks.